My area is pulmonary and critical care medicine, so that's lungs, but also the intensive care unit. Recent discoveries and research are a big part of who we are at the University of Michigan generally, and certainly my own discipline, both in the inpatient side, as I say, in the ICU, and the outpatient side. On the inpatient side, we do ARDS research, and when our practitioners, our referring physicians, want help, they should refer them to our medical ICU. You know, it's an excellent place. I'm very proud of them there. We're doing research there. I participate nationally in some protocols and research. So it's a big part. And on the outpatient side, my colleagues, I work with them in a collaborative manner. They're first rate. We're a destination program for lung scarring conditions and COPD. I'm a co-investigator on all that work. So, I mean, that's what makes this a great place, to be right on the forefront, for our citizens in our state and beyond, to really offer this kind of care, this kind of first-rate care, be engaged in a research manner and engaged in an intellectual manner with our colleagues and peers across the country. I've had a lot of impactful stories through the years. You know, I can think of a Thanksgiving card I got a few years ago from a woman who was transferred down from Saginaw area with ARDS, and as I say, we're the place. Send them to the medical ICU, and she was quite ill, about 10 days into her course, as I recall, and we got her better. Not only we got her better, she went home. She didn't go to a rehab facility, for example. She went home, and that was in the spring, and in in the fall, Thanksgiving, she sent me a wonderful card, picture of her with her children. And you really know you made a difference at that point. You know, I mean, she wasn't sent here because it was easy. She was sent here because it was tough. And our medical ICU is the place for ARDS, and it's tough. It was a tough case. I'm not saying it was easy, but very gratifying to take someone sort of back from the brink, and not only back from the brink, but really restore them to the way they were before the bad illness set in. Very impactful in that regard. But I mean, I've been around a long time. I mean, that's one that's really stands out when you get that card out of the blue, picture of the family, and you know, it's really something.